Hello and welcome to Medical Management of People with HIV as the Age, a course for non-geriatricians. And I am Roger Bedimo, Professor of Medicine at UT Southwestern Medical Center. My co-chair is Dr. Kristine Erlandson of the University of Colorado School of Medicine, Professor of Medicine as well. And here are all the activities that IAS-USA can provide. A warm welcome to all 163 attendees joining us from all corners of the United States and abroad. And this is a pre-activity knowledge and practice assessment with the questions that were submitted to the participants. As of CME information, the IAS-USA is created for 4.75 AMA-PRA create 1 hours for this activity, and physicians should claim their activities. And this is all the professionals who can claim activities, 4.75 CME, physicians, nursing, pharmacotherapy credit units, as well as pharmacy contact hours.
Just as a reminder, we ask you to use the Q&A button that's on the bottom bar for any questions that you have that you'd like to pose in the discussion. When you post your question, please use your full name and your institution. If you don't include your institution, the question will be returned to you and ask that you add your institution so we can see that. If you post questions in the chat, we will not be able to answer those. So please make sure you're using the Q&A button. There'll also be polling questions that will pop up in a new window. Please do answer those polling questions as that will help to inform some of our discussion points today. So here's your first test at a polling question. What proportion of your patients with HIV in your clinic are over age 60 years of age? None, 25%, 50%, 75%, or 100%? And it looks like the majority have about 25% of patients that are 60 years or older, and some have up to 50%. So kind of consistent with what we know in the demographics of the US. Next slide. When managing age-related concerns in your patients with HIV, you typically A, manage most issues yourself, B, co-manage with geriatrics, C, refer primarily to geriatrics for aging issues, D, do not have access to geriatrics, or E, this is not applicable to my practice. Great. Looks like many of you are managing these issues yourself, which could be because you do not have access to geriatrics, which is about 23% of the group. So hopefully we can help give you some additional considerations for when you're managing these patients and don't have access to geriatrics. And next question. Follow up for the prior question. Do you have geriatrics at your institution? A, yes, it's readily available. B, yes, but has limited availability. C, no, it's not available, or D, I don't know. And it looks like most of you either have limited availability or it's not available, hence the reason many of you are probably managing these issues on your own. And how comfortable are you managing aging-related comorbidities in adults with HIV? Very comfortable, somewhat somewhat uncomfortable, or very uncomfortable. And it looks like kind of a moderate range. Very few people are very comfortable or very uncomfortable. So some somewhat uncomfortable, comfortables in between. So excellent. Thank you for responding to those questions. With that, I'd like to acknowledge our grant support for the presentations today as listed here. Financial relationships are included within each slide as well as in the e-syllabus booklet. And then handouts are available in the modular e-syllabus booklet that's on the webpage. Some of these slides may have changed a bit since the posting, and the final slides will be available after the course on the activity webpage. Just a brief overview of the agenda. Dr. Bedimo will start us out with some introduction background on aging with HIV. We'll have delve into some science on HIV, specifically with epigenetics and some other hallmarks of aging. We'll have an interactive panel for about an hour on immunization specific to aging adults with HIV. That will be followed by a quick break. I'll talk a bit about frailty assessments in people with HIV. We'll have a discussion on heart health and overcoming clinical inertia, and then some discussion on aging and cancer, and lastly, aging, HIV, and the brain.